Hi everyone, this is Dr. Echols again, and it's been a while since I've been with you, but I'm really glad to be back. And today I'm very fortunate to have a beautiful young lady with me, Miss Mandy. And before the video, we had spoken some, and she had told me that she's been having some neck issues that are kind of radiating down into the shoulder. As a matter of fact, it was bothering her so bad that she really was having trouble reaching out and setting things down or picking things up. Not a good situation. She's also been having some headaches that have been pretty frequently that are related to that. So I'm going to show you how I would go about working that up. We're going to work with her a little bit, see if we can get her some relief. And I'll also be sharing with you some things that you can use at home to kind of help with these areas and see if we can get you some help as well. So first thing we want to do, we're going to be checking a lot of muscles today. And that's the way that I kind of figure out what's going on. And I always tell my patients that finding a weak muscle in the body is kind of like having a check engine light come on your car. When that light comes on, the light itself is really not the problem. It's just telling you that there is a problem somewhere in the car. So when I find a weak muscle on Mandy today, that's not really the problem. It's just kind of going to be guiding me toward other areas of her body. And by the way, it could be anywhere in her body. It could be in her neck, her shoulder, her hips, or it could even be in her toes. It could be anywhere those problems could be. So as I go through the muscle testing, it'll become apparent where those problems are, and we'll start working with them. And then hopefully when we're done, I'll go ahead and recheck that muscle that was weak, and if everything goes well, it should be strong before she even gets up off the table. So very similar to the check engine light on your car. Once they find that light, they plug in the computer and they figure out where the problems are in the car. And once they fix those, then the check engine light goes on. So let's go ahead and get started doing that. We're going to start by checking some of the muscles that are most commonly affected up here in the shoulder. The first one is the posterior deltoid. And I'll just go ahead and name the muscles for you in case you're, like anatomy. It's not really important that you know these, but it's kind of nice. Occasionally I have other doctors or people in other countries that are, trying to learn this information, and they always appreciate it when I give the proper name of the muscle, but don't let that hang you up. So this is the posterior deltoid. Mandy, I'm gonna have you push back for me like that real hard. And that muscle is locking in place, which is the criteria. I'm a big guy. I could easily overpower Mandy if I wanted to, but that's not the point of the test. The absolute strength of the person. What is important is if the muscle will lock into place. If it ratchets or the person just can't hold the muscle up, it's what I call a neurological weakness. And that's when we have a problem and we know we got to go look a little bit further. So this posterior deltoid is working fine. The next one I want to check is called the upper trapezius muscle. And it's very important that you position the person properly. They automatically know whether that muscle is going to be weak before I even test it, and they'll start rotating their arm or trying to bring other muscles into play. We call that recruiting other muscles, just kind of unconsciously, because they want to do what I ask them to. They want to have be able to push against me, and if they can't, they'll cheat if you're not careful. So we have to make sure she's in that position and then push back that way for me. And that muscle, see, she can't do it. She's laughing because she's trying real hard, but it's very easy just to push that muscle down. It won't work. So this is her upper trapezius muscle. And we're going to go ahead and check a few muscles before we get started in the actual treatment. The next muscle that we want to check is the middle trapezius. The trapezius is a big muscle. It hooks on from up here. The upper trapezius hooks on up here near the occiput. It comes down, it hooks into the shoulder area. Then the middle trapezius is in the middle part of the spine here, and then the lower trapezius actually goes down even further. So right now we're going to check this middle trapezius, and Mandy, I want you to push down toward the floor with your hand, and that muscle is locking real nicely. Perfect. And so thank you. And we'll push here. Now push down for me there. This is checking the lower trapezius, and it's in great shape. So a couple of other muscles that we're going to check. This is the pectoralis major. And you'll have them turn like this, and we're going to have you push across toward the window there. Go ahead and push across. And that muscle is real strong. It's working perfectly. The next muscle we're going to check is one of the most important muscles in the shoulder blade, shoulder itself. It's called the subscapularis muscle. And this muscle is the muscle that actually stabilizes the whole shoulder. In my practice, when I find this muscle weak, I caution the person to not go to the gym, not to work out right now. Don't do a bunch of push-ups. Don't do anything that's going to strain that shoulder, because with that muscle being weak, the shoulder is unstable, and your chances of injuring yourself by lifting weights or doing whatever exercise you're going to do is pretty high. So we always go ahead and fix that muscle first. That brings stability back to the shoulder, and then it can work. Because if that muscle doesn't work, you're going to try to recruit others, and they're not designed to do that particular movement, and you're going to end up hurting yourself. So subscapularis, you're going to rotate down this way for me, Mandy. Push down. And that one's working great. And this one is then for spinatus. Push back that way. Very good. And this one, we're going to have you put your hand underneath your body, just like that. And don't let me pull your arm up. Keep your elbow pushed down into the table. And that one's working great too. We're going to check the supraspinatus muscle. Put your arm here, and then you're going to push up and out that way for me. Push. And that one's working real nicely. So now, this is the latissimus dorsi. We're going to have her put her arm right here, and don't let me pull out. And that one is working good too. So really, the only muscle that we could find in the shoulder blade area, with this shoulder area, is this upper trapezius muscle. Let's go back and recheck it again. Push up that way. And when she tries to do it, she has absolutely no strength there. Completely fails. And oftentimes the person, do you have some pain associated with that when you do it? They will. It'll hurt when they try to do it. And when we're successful in correcting these things, not only do they get their strength back, but it doesn't hurt when they try it anymore. So that's actually the thing that you care about most, too, whether it hurts or not. So, what do you say we give this a shot and see if we can get this a little bit better, okay? Now to do this is like she's got a check engine light coming on. It's on the car. Now we don't know what exactly the problem is. We don't know why that muscle is necessarily not working, but we know it's not. And that's the little check engine light that's coming on. So now, in this case, I'm going to be the computer, and we're going to do some muscle testing, and we're going to try to find out what different things in her body are causing this muscle to not work properly. So she's going to just hold this arm here for me, push back that way just a little bit, just like that. You've done this before. And then we're going to find out a little bit about what's going on. All right. So she's got an issue. This is called a neurolymphatic point, and it's right there. Is that kind of tender a little bit or not so much? Right there. There it is. Okay. And that's a real kind of a good sign that you're on the right spot. The patient will tell you, oh man, that's tender. How did you know that was tender there? And we're going to go over here and so I'm holding that spot, and I'm also holding where this muscle, kind of right in this muscle, the upper trapezius. And I'm feeling for pulses in these muscles because these points have actually stopped communicating with one another. That's one of the reasons it doesn't work. And by holding these points, the body will reestablish a neurological connection there. And I will know because I will feel these pulses start to synchronize. And when they do, I can move on to the next phase of the treatment. So I'm starting to get some good pulses there, and then they're starting to synchronize. And oftentimes the person will tell you that it's not very sensitive anymore. The pain is kind of lightened up. Is that the case? So it's kind of lightened up. The pulses are there. They're synchronized. It does take a little practice to feel those pulses, but once your fingertips get pretty sensitive, it's a lot easier to do. So we'll continue checking And I'm basically just using the body's anatomy and neurology to help me determine where all of these problems are. And you've got a place in your neck that's out of place. And I might as well mention this. A lot of times people come in and they're complaining of shoulder pain. And I'll say, does your neck hurt? And they go, no, my neck doesn't hurt at all. But yet we find out that the problem is not in their shoulder, it's actually in their neck, even though their neck doesn't hurt. So you've heard me on other videos, and I'm going to say it again because that's so important. You've heard me talk about my little wiener dog, Yoda. If I accidentally step on his tail, it's the other end of him that barks. So you can't really go by where the pain is. If I step on his tail, it's the other end that barks. We may be stepping on her tail up in her neck, but it's going to be barking in her shoulder. And I get a little bit of blowback sometimes from people. I go, no, doc, it's not my shoulder. It's not my neck, it's my shoulder. My neck's fine, Well, trust me, it's not that easy. So she's showing that she has some problems up in her neck area, and I'm going to go ahead and find out exactly which vertebra that it is. Oftentimes, the doctors will just kind of twist the neck or adjust it haphazardly. We're going to be real specific, and we're going to find out exactly which vertebra needs to be moved. We're also going to find out which direction that we should turn the head, and we're also going to find out which line of drive that we should make or which way we should thrust on the neck to make sure that this thing gets corrected properly. So hold right there for me. Good. Okay, turn your head that way, all the way. Okay, turn it back this way, all the way toward me. Let's come over here. Come back to neutral for me. Turn this way. Okay, so now I've determined that her head needs to be turned this way to adjust it properly, and the line of drive needs to be this way. So we've got Miss Mandy in the right position here, and in this particular case, it's the third cervical vertebra. Now remember, in the cervical spine or the neck, there's 7 vertebrae, and it's important that you know which one it is that's causing these problems. In her case, it's the third one down from the top. So we're going to get right on that vertebra there and just to gently move it just like that. You still with me? Yeah. All right, that a girl. Just like that, in the hopes that that's going to free up that nerve and be a very big component for solving this whole problem. Now, we're going to go back and check here again. Push. She's still got some other issues that we need to resolve. Okay. All right. Okay, so a lot of times we find problems in people's feet that are affecting way up here in their shoulder. And in her case, she's got what we call the third metatarsal. If you look at the bones in the feet, they're those big bones that are down here that your toes are connected to. So in her case, her third metatarsal is out of position. I don't know that you'd be having any sensations or pain in your foot recently, but we're going to need to adjust that before we go on. Okay, so we found that part of her shoulder problem was actually originating in her foot. So these long bones that are here in the foot, we call those the metatarsal bones. And in this case, her third metatarsal, which is connected to this bone here, her toes, is out of place. And usually they move this way. So what we're going to do is make an adjustment here and push that metatarsal head back into the right position. Just like that. Okay? Did you feel that? Yes. Yeah, she certainly did. And now we want to make sure, let's find out whether we're finished with our treatment or if there's still other things to do. And while we're talking about this, let me just mention that when we find a muscle that's weak, there's only one of three different things that can be wrong with it. It can either be caused by a mechanical problem. They have a bone out of place in their neck, or they have a nerve that's being disrupted in their neck or their back or anywhere in their body, a mechanical problem. It could also be a chemical problem. In other words, maybe this person has got, like a vitamin deficiency, or they're allergic to certain foods and they're eating them continually and they don't realize they're allergic to them. So it could be a chemical problem. Or also like a visceral problem, like they have problems in their stomach or gallbladder that could be causing these kind of issues. And the last one is emotional issues, psychic or mental, emotional kind of problems that can actually be blocking or blowing out circuits in the body and that are shutting these things off. And it's nice that we have tools to deal with all of those. So let's go back and check here again. Okay, so now that we have taken care of Miss Mandy's foot, let's go back and let's find out whether the body says there's anything else to do. And when their arm goes weak like this, normally she'll be able to hold it up, but in this particular instance, she's not going to be able to. That's kind of a signal to me that, yep, doc, you cleared everything out of that needed to be fixed in order to fix her arm. So at that point, we will go ahead and recheck the muscle and verify that in fact we did get the problem fixed. If it's still weak, then that means, I messed up or I missed something. And so we'll go back and we'll recheck everything. And that does happen occasionally. And one of the reasons it happens is because the patient gets so relaxed on the table, I get a kind of a false indication because they're almost half asleep. They feel so relaxed and their arm goes weak, and I have to really keep them with me and make sure they're participating with me. I need their help to do this. So let's go ahead and check that again. Miss Manny, you turn this way and you're going to push back now. Push back for me. My goodness gracious, you have got a lot of strength there. Now, does it hurt? Before it hurt real bad when you did that, is there any pain now? No. And that's what you'll hear a lot of times when we're checking a muscle and there's a problem. Oftentimes it's painful for the person to even do that, and they give out and they can't do it. And then we'll go through this procedure and we'll fix the problem. And now, not only do they get the strength back that they were lacking, but now it doesn't hurt when they do that, which is always a big surprise, a pleasant surprise for the person. So this is where that upper trapezius muscle is. And of course, that feeds back up into the neck and into the head, which is probably one of the reasons she was suffering from the neck pain and the headaches. So neck pain, headaches, shoulder problems, they can all be linked together. But it's not always caused by just a problem up here, as you saw. Sometimes there's an issue in the middle part of the spine. We didn't find that on this particular visit, but we did find some problems down in the feet that were contributing to this. And if we wouldn't have fixed that, this problem probably would have recurred or not been able to have been fixed. So we tap this muscle like this just to kind of re-challenge it, and then we'll go back and we'll check the muscle again, push back, and it's still real nice and strong. And that's how we go about doing this. Okay, well, thank y'all so much for watching. It's been great to be here with you again. We ran over a little bit today, so I'm going to save my tips and my tricks for pain relief at home until the next video. If you'd like to go ahead and look at that now, feel free to go over to wellnessplus.tv, or you can actually see it for free on Amazon Prime. Also, don't forget to check out my website at www.jeffechols.com. Wishing you the very best until next time. Bye-bye.
With hundreds of videos that you can stream on virtually any device to help you reduce stress, lose weight, or just improve your health and well-being overall. At wellnessplus.tv, we are dedicated to helping you on your health and wellness journey. Join wellnessplus.tv to find hundreds of videos to help you improve the health of your body and your mind. WellnessPlus.tv. Get well, feel better.